Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi friends, welcome back. I'm so excited for our interview today. I've been wanting to do this podcast for a while to explain just kind of what concussions are and what post-concussion syndrome is, and to get it really well defined. My guest today, Dr. Jaycie Loewen, is an amazingly qualified person to explain these things to us. She is a Howard Hughes Medical scholar who received her PhD in neuroscience alongside a master's in clinical investigation. In her work, she has collaborated with the Anticonvulsant Drug Discovery Laboratory at the University of Utah and published articles on viral mechanisms of brain injury, seizures, and traumatic brain injury. She held the position of Director of Research and Clinical Operations at Cognitive FX, where she worked with patients, oversaw treatment alongside other practitioners, and headed the clinic's research initiatives. Dr. Loewen is now an educator and content creator for students within both college and clinical spheres. So, Jaycie, thank you so much for taking the time to share your knowledge and expertise with us.
Of course, thanks for having me.
So to start off, why don't you tell us a little bit more about you, what's your history, and what got you interested in concussions in the first place?
Yeah, it's been a long road. So originally I wanted to go to veterinary school, and then I did the pre-med, and then figured out I wanted to go to PhD route, and then started with neurodevelopmental disorders, and then dabbled in seizures. And then that kind of led to, when I graduated from University of Utah with my PhD, a little bit of what in the world am I really interested in? You've gone through so many paths. Do I want to go back and do something that I've already, done research in? Do I want to do something new? And I happened to learn about Cognitive FX and what they were doing. And what really caught me was the word fMRI, functional MRI. The minute you see that, okay, there's a clinic working with patients and they have an extremely powerful modality to get basically images of the brain and the brain's functioning, I was hooked. So interviewed, I was accepted and taken on, and then went from a clinical neuroscientist, and then eventually went up to the director of operations. And it was a very cool experience. It was really neat to just have this MRI machine in the clinic that you could run any manner of experiment with.
That's so awesome. I love it. Sounds like it's been quite a journey. You've done a lot of things and then kind of focus in on this. That's awesome. So tell us, what is the definition of a concussion? Like, what counts as a concussion?
All right, this is where you can put several doctors, neuropsychologists, and PhDs in a room, ask that question, and watch them duke it out. It will be a battle. So concussions have a pretty simple general definition, which is that it is when the head is moved or impacted in a way such that it disrupts the brain's innate physiological processes. So, but that's pretty wide. You might be going, okay, does that mean I have to lose consciousness, for example? Does that mean a little bump can suddenly give me a concussion? And it's a really big gray zone. There are really so many variables that go into, is one person going to get a concussion in a situation versus another may not? And this can be genetics, gender, diet, age, 100 different things. Generally, what we like to consider concussion is it's not just a tap to a head, but it's also not as severe as causing large structural damage. That's where you go from mild TBI, which is concussion. And if you do have structural damage, that's where it starts to go into severe TBI. So it kind of sits in this amorphous zone where if you do something like a CT or an MRI, you're usually not going to see anything from the injury because the MRI or the CT just can't zoom in enough to see the tiny little cellular changes that may have happened as a result of a concussion.
Okay. Oh, that's really interesting. So a TBI is traumatic brain injury, right? And so a concussion is considered a mild traumatic brain injury. And then if there's structural damage that they can see in an MRI or a CT scan, then that's considered more on is it moderate to severe?
Moderate to severe, yeah.
Okay. Very interesting. So if somebody doesn't necessarily have to have passed out to have a concussion, and do you even have to have hit your head to have a concussion?
No. So this is something we came across a lot at Cognitive FX, which is multiple people will go, I didn't hit my head. Well, let's imagine you're in a car and you're on the freeway here out in Utah. It's like 70, 80 miles an hour. It's fast. And imagine if somebody hits you, like if you're in still stop traffic, somebody's on their phone and they hit you. That's a huge impact. You're going to have whiplash forward and backward, and that will cause a concussion, even if your head doesn't hit the headrest. It's really under-recognized, these whiplash or head movement type injuries or blast injuries in veterans can also cause TBIs.
Interesting. So just being near a blast can cause that. Yeah. Okay. So how can somebody know if they've had one? What do they do? How do they know?
So a lot of this is knowing your body and also advocating for yourself. So the first thing is that if you do pass out, if you do have a severe kind of injury to the head, it is always best to go get a doctor's opinion, just in case something might happen. And this doesn't matter what age you are. If your kiddo fell and hit their head and they're screaming and in massive pain, get them to the hospital. If your husband, who always says, I'm fine, is a little woozy after that head hit, doesn't matter what he says, get him to the hospital. Now, there's a lot of assessments that they can do. For sports, sometimes you could do kind of like balance tests on the side of the field. You could compare those tests to the athlete's baseline, which they've checked before. So those are great tests because it's like, okay, I know what you're like normally, and I know once you've got a head hit, if things are a little wacky. Unfortunately, for most of us, normal peoples that aren't a professional NFL player, we don't have baselines. So what doctors will generally do is they'll do an assessment verbally. They'll ask you about the injury. They'll ask you about symptoms. In some cases, they may even do some neuropsychological testing. Typically, that comes a little bit later. Neuropsych testing is kind of saved for after that initial assessment, but in some cases, you can meet the criteria for concussion in those tests. And typically, they'll do things like checking your eyes and checking your balance. But unfortunately, it's very subjective. There are so many ways in which you could potentially pass these exams and yet still have a concussion. So here's a couple examples. Let's say you're a gal and you're playing soccer and you had a ball really hard and you're going, ooh, okay, I don't feel right. And then you go get your balance checked and the athletic trainer goes, wow, your balance is perfect. Well, females, since they have lower center of gravity, can often pass these tests with flying colors. So here's one situation. In another situation, symptoms don't always have to develop immediately. They can develop hours or days later, sometimes even weeks. There's a couple reasons for this physiologically. So when you do have those, if you're thinking and zooming in on the brain and you're seeing all of these little cool cells, when you have that injury, your brain goes into let's fix it mode. Because if we don't have our brain's not functioning, we might not survive. We could get eaten by a predator. So the brain will start rerouting things and fixing things and building barriers so that we can still walk and run and talk for the most part while all of that is going on. Now, unfortunately, there may be some cases where the brain is doing really well immediately, and then it's like, uh-oh, this was worse than we thought. And there may be inflammation. There may be disruption of white matter tracts, so the big highways that allow neurons to talk to each other. And this can occur on a different timeline from person to person after their injury.
Okay, so it could, you said up to weeks after?
Yeah, it's really rare. It's like typically the latest, we typically see the most You have some at the beginning, kind of wooziness, you get a little bit of light sensitivity. For the most part, people kind of get over that over the first couple of days. Some patients where it develops a little bit later, kind of comes on like, whoa, it's probably more of a surprise psychologically, which is why it might feel more intense.
Mhm.
For our couple week patients, they're really rare. And those are the most difficult to diagnose because they immediately are going to blame it on getting sick or being stressed because it didn't occur right after their injury.
Yeah, that makes sense. Do concussions have a cumulative effect? Like does it get worse with everyone?
That's the thought. Unfortunately, there's a really limited amount of research that goes into kind of having concussions over the lifetime. We know generally that they predispose you to things like dementia and neurodegenerative disorders. Even the big one, CTE. Let's see if I can pronounce it. Chronic traumatic encephalopathy. I think I got it right. But it's really not known. Like, okay, after I get my first concussion, how predisposed am I to getting another one? Is it 2 times more likely, 5 times more likely? We really don't know that. And again, probably comes down to all of the variables we just discussed before.
Mhm.
What we do know is that it very likely gets worse with each one. So actually, Dr. Hannock, who also used to work at Cognitive FX, liked to use the term brain duct tape. So the first time you hit your head, big slap of brain duct tape over that, you're probably fine. Then the next hit, oh, put another, piece of duct tape here. But over time, there's only so much duct tape you can use.
That makes sense.
There's actually some really cool research showing that females, for example, are more likely to develop chronic issues after one concussion versus males are more likely to have more concussions in general. So that's another factor, which is we base a lot of our measurements and statistics off of males. If you actually want to dive into kind of the pharmacology side, it's really interesting. A lot of the testing is done on male mice. The participants are mostly male. And so I also believe that a lot of the research that goes out there is a little bit biased currently because we're having to kind of remodel science to test some of these hypotheses. Also, males tend to not talk about their symptoms as much. At the clinic, it's typically wives bringing them in. But that's the incredibleness of really making sure that you're assessing each patient individually and not trying to generalize them as a number.
Yeah, that makes sense and really interesting. So do you know if you do have a concussion within a second concussion within a certain amount of time of the first, is it more likely to have more damage or what?
Yes.
Okay.
Yeah, it's called second impact syndrome. So this is often seen in sports players. And so they'll get an immediate concussion. And then if you get another one within a certain amount of time, you can have brain swelling, bleeding, seizures, for example. It's incredibly severe, and why there needs to be a lot more talk in athletics, NFL, etc. But if a player is suspected of a concussion, it doesn't matter how much he's involved in the game. If he's your star player, do not put him back onto the field because he might die.
Holy cow, I didn't realize. So what is the amount of time there?
Yet another gray zone. It's thought to be within, immediately after the hit to maybe sometimes, depending on the severity, a couple hours to even maybe a day or more, but it's hard to know. Because a lot of when we're seeing this is in high impact, person against person, for example. And the first concussion is pretty severe. So sometimes it's hard to know, like, was it actually the first concussion was the match on the straw bale, or was it the second one? Was it combination? Was it the timing? We don't know a lot about it.
Okay. Oh man. I didn't know about that. That's really crazy. So that's part of why it's important for kids to be taken out of their matches and just not put back in if they've had a concussion for a little while, right? And I think they're getting better about that in schools and across the nation, right?
Yeah.
Right. That's good. So you talked a little bit about how concussions are diagnosed. Is there anything else about diagnosis of concussions that people should understand?
Yeah, so we probably didn't talk much about the Glasgow Coma Scale. So it's a scale of symptoms that kind of will help differentiate very basically, like, okay, your score suggests that things aren't really bad. It's more of a concussion versus it's in the name, coma scale. If we've got scores where you're literally unconscious or in a coma, then we're probably more having to do with a severe TBI. But overall, I would consider it kind of a mess of assessments that will really be based on what doctor you're seeing. Are you seeing your GP? Are you seeing an ER doc? Are you working with an athletic trainer? Everybody's going to approach it a little bit differently. So again, it's really important to simply get your history taken, because if something does happen down the line, like post-concussion syndrome, it's good to have that record.
Yeah. Okay. That makes a lot of sense. And if somebody has had a recent concussion, what should they do other than going and getting assessed? Like what would be the next steps most likely for them, or what should they be thinking about?
Current research says do not cocoon. That's pretty old advice that we find is actually making outcomes worse. So cocooning is where you avoid screens, you avoid light, you avoid noise, you kind of go into your bedroom, shut the door, close the blinds, do nothing. What you want to aim for is the first 24 to 48 hours is taking it easy, kind of hang around the house. Don't really, for example, don't suddenly jump in and take your final exam, really email your teacher and go, I just had a concussion. I'm going to see my doc. I need to chill out for this period of time. Keep an eye on your symptoms. If they worsen, immediately go to the hospital. After that 48 hours, start to increase your activity. Physical exercise is being key, is the magic, antidote to developing chronic symptoms after. So making sure you're going on a walk, making sure also that you're eating well, getting lots of omegas and vitamins and things like that is really going to help your brain repair and recover from that concussion.
Okay, that is really interesting. What about, is it best to avoid screens, and how much, cognitive stimulation should you be doing?
Mm-hmm. Things like reading a book, for example, or listening to a podcast are pretty easy on the brain. Screens are pretty intense, especially since we've got here in the US that 60 hertz flicker. Our brain is generally pretty good at filtering that out, filtering out a lot of the blue light and the really intense color spectrum. But after you've had a brain injury, that can be pretty intense. So jumping on and playing 4 hours of video games, probably don't do that. But watching, a 15-minute YouTube video and then closing your computer and going out to get some sunlight is totally okay.
Okay. And is there an amount of time that it's best to try to limit screen time, stuff like that?
There aren't really good hard rules, unfortunately. I would say always pay attention to your symptoms. If your symptoms spike when you're looking at screens, wait till that 48 hours are over to try it again. Try to especially not use screens when it's dark out. That contrast of dark to light isn't good. And then blue light can interfere with your sleep cycle. So no screens at least 2 hours before bed, which can be tough. We are attached to our phones continuously. So if that's really, really difficult, put the blue filter on your phone on that. That's probably a good compromise. And then I would stay within normative limits for adults. So definitely try not to exceed a couple hours of screen use if you can. And then if you are using screens, make sure you're using the 20-20-20 rule. So this is where when you're on a screen, every 20 minutes, have an alarm go off. When that alarm goes off, look at something 20 feet in the distance, if you can, for 20 seconds. It's a really good visual reset. And you can also use palming, which is where you put your palms delicately over your eyes. You don't want to press down. And then wait till all those little floaters and lights calm down. So that's allowing your visual cortex to reset as well. Using both of those methods, you'll be able to mitigate some symptoms and probably be able to use screens a little bit more, especially if you need to do little work things or school things that just you can't get out of.
Awesome. Are blue light glasses or specific types of glasses helpful?
Yeah, they could be helpful. Some people find the blue light glasses give them a headache. So generally in that case, they're probably not worth it. You can always use different programs like Flux, Flux, which is a program you can install on your computer, for example, and it will lower the blue light and even do it on a timer. So it's really cool. Like I have it on my computer, and at night, starting whenever sundown is, it'll start lowering blue light until it's at 0, 2 hours before my bedtime. So even if I get stuck on my computer and I'm not really focusing all the time, at least it's automatically dimming that blue light for me.
Oh, that's really interesting. That's cool. Thank you for that. I'll have to check it out. So I'm curious about injuries for children. Are babies' brains more likely to heal? Because toddlers hit their heads all the time, right? Like, I feel like it's got to be built into the system to take care of that. But I don't know, has there been research on that? Yeah, what can you tell us about that?
So there were two schools of thought, just like with cocooning. One school of thought is, yeah, kids fall all the time. I mean, toddlers are so top heavy. You wonder how they can stand up at all. But their brains are also more fragile. So if you do an MRI on a child as they are developing into an adult, what you're going to notice is it's almost like a construction zone. So first you get the framework, you can see what the building might look like, but it's not totally filled in when they're babies. And then you kind of hit those, 5 to 7 year old periods where, oh, okay, we're starting to see things fill in, things are getting more complicated. And that increases progressively over time until generally the teen years. And so if you do that MRI, you're going to see that scaffolding build and the brain get denser and denser and firmer and stronger. So here's where it's kind of difficult, because if you think about that framework, if I have a hurricane or a tornado or an earthquake, that framework's going to go down pretty quickly, versus the entire building has all those safeties. So it can bend and kind of survive that a little bit better. I think there's another layer to this, which is plasticity. We talk about this all the time. It's the new cool world. Well, it's an old word, but now it's cooler. People are really getting interested in it. But definitely for children, their brain is very plastic. They're learning. I mean, it's amazing. You're a mom, being able to see a child learn something so quickly, and you're like, man, I wish I had that superpower. How do they absorb this information?
Yeah.
And so their brain is really good at going, okay, we're good, we're plastic, we can be flexible with this injury, maybe even heal. Versus when we're adults, our brain is just not, it's not as malleable, it doesn't respond to things as well, doesn't shift gears as well. So these components combine, the structural and the functional, into kind of, okay, how severe is this injury going to be? Here's another crux. Let's talk about research for a moment. It's really difficult to know whether a kid's had a concussion because they can't report symptoms as well. So they might just go owie, 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 and the doctor can't go, okay, rate your fatigue from 1 to 10. It's just
right.
So I do believe a lot of childhood concussions go unreported and undiagnosed. And then we have to realize that a childhood concussion can affect you later on in life. So, I don't want to be too careful. We don't want to stick our kids in a bubble and never let them outside. But we also need to be a little bit more cautious with, okay, kind of as a parent, what's my baseline for my kid? If a child has a concussion and they're experiencing issues, typically they'll start reporting pain, for example. So that's a red flag. And if you start noticing mood changes. So those are two things. If a kid's had a concussion and they're starting to talk about that or demonstrate abnormal behaviors, take them to the hospital, get them assessed. There are multiple clinics that can assess even babies for concussion. There are specialty clinics where it's like, yeah, we know how to assess a child. So I would almost suggest that, you look at your options. Yeah, there's the ER. Yeah, there's your GP. But search the internet for specialized concussion clinics, because they are going to be the premier care, especially for your kid.
Okay, I did not realize that they had concussion stuff for babies specifically. That's really cool.
I will be honest, I've been working in the concussion realm for a while. I didn't know that till a year ago.
Okay, that makes me feel a little bit better. Especially like as a mom, I'm like, oh crap, I should have known this. So you were saying they'll do assessments on babies. Will they actually treat children and babies as well? And they can get...
Typically, again, if we're going back to the suggestions I had before about physical activity, they can give recommendations about how long to kind of rest and relax, recommendations on how to start physical activity. Some clinics may even have therapists in-house that can work with the child. So they'll give you a variety of different options. And then hopefully, the ultimate goal is that the kiddo recovers, they're all better, and they can go back to their day-to-day life.
And how do you know, I mean, maybe this is a silly question, but how do you know if you're better from a concussion or not, or if there's going to be lingering symptoms?
If I knew that, I would have the Nobel Prize.
Dang it.
We are so good as humans at adapting. There are so many patients I've worked with that are like, yeah, I just got used to a 7 out of 10 headache every single day. I didn't even think about it. It's kind of like, whoa, that's not normal. Why are we normalizing this pain? Why are we normalizing suddenly having to take Adderall or Ritalin after your injury because you can't focus? So definitely, really checking in with yourself and maybe even asking family members, what changed? Be honest with me. Is anything weird? Is anything outside of the norm? This is sometimes where especially family and your constant medical practitioner may be good because they'll know you, they'll know your history and all of that. And if you start complaining of again, like, oh, I'm having headaches, they might go, did you hit your head recently?
That's good to know. I think that is something that I've noticed with patients at Cognitive FX is sometimes their family members notice things before they do, whether it's like noticing symptoms that they're having or noticing that they're getting better from symptoms. It's pretty interesting.
Yeah.
So let's go more into this post-concussion syndrome. Can you tell us what exactly that is? At what point is lingering concussion symptoms given that diagnosis?
Remember that room of doctors and PhDs and neuropsychs? This is the second question you asked them. People believe it's not real, that post-concussion syndrome is more of a psychological phenomenon than a physiological one. I could get on a soapbox about psychology and physiology kind of being the same thing, but that's a topic for a later time. So let's go back to that plasticity component. The working theory right now is that once you get an injury, especially as an adult, with all those pathways set up, chugging along, all the gears are turning. If you get an injury, the brain needs to heal, but the brain might reroute pathways, and because it's kind of stubborn and doesn't like to change, it may get stuck in that alternate route. So rather than going from A to B in a straight line, it's doing this twisty turny, and that's going to cause changes in the brain's function. That's going to cause waste of energy in the brain. So it's going to tax those resources, and it will lead to symptoms. So the general thought is that if you're having symptoms for 3 months or more after your injury, you're starting to meet that criteria for post-concussion syndrome, or it can also be called post-concussion symptoms. There was a big drive to make it symptoms because syndrome is more of a kind of a label of just like, now you have this syndrome, versus these are correctable symptoms that should be temporary, if worked on. So generally, if you're going to do a PubMed search or look online, you probably want to do both because it'll bring up different things. They're both commonly still used. Now, these symptoms that you can have are typically mood related. So that could be anxiety, depression, personality changes. These can be sleep related. So these can be where you're not sleeping as much, or suddenly you're sleeping 15 hours a night, and that's how much you need to actually feel energized. You could constantly wake up tired. You could develop really severe, for example, like waking up multiple times during the night. Then you have the cognitive symptoms, which could be issues with memory, focus, really just kind of using your brain for work or school, for example. And then the last ones are physical. So these are headaches. This is pain. I'm going to add one more. It's typically kind of set underneath physical symptoms, but I want to give it its own category, which is vision and vestibular. So this is dizziness. This is light sensitivity. This is suddenly getting double vision. This is becoming klutzy, and suddenly you're like, I have no sense of proprioception. I don't know where my elbows are at. So within all of those domains, if you're meeting a couple of those criteria after your injury, you may meet the diagnosis for post-concussion syndrome. Typically, a lot of practitioners like to rely on neuropsychological testing to determine that. So you sit down with somebody, you do some tests, they're going to evaluate your brain functioning. It can be useful, but it's not perfect. Because we are so good at adapting and compensating, many patients with post-concussion syndrome will just score beautifully on these tests. And even ones with very severe symptoms will score average. Now, why would that be? Well, imagine if you're super above average, and now you've got really horrible symptoms, it knocks you back down into the average category. But it can be really difficult to look at a neuropsychologist or a therapist and go, I'm not trying to brag, but I was pretty smart before this concussion. Maybe a doctor might believe you, and they might roll your eyes like, sure, yep, you just don't like the average score. So always paying attention to symptomology, changes in quality of life, and then really, again, looking at the patient as a whole and not relying only on those numbers is the way you need to go about it.
Is that why so many people come and say nobody believes me that I'm having these issues.
Yeah. Yeah, definitely that. And the fact that a lot of neurologists and doctors are simply not trained on post-concussion syndrome. They're probably well acquainted with traumatic brain injury and other kinds of brain injury. But when it comes to chronic symptoms, we found that there's just this absence of collective knowledge on it. I've talked to neurologists, called them up and went, so do you have any questions for your patient about going through post-concussion syndrome treatment? And they go, what's that? What's PCS?
Oh,
most,
wow.
most younger neurologists are willing to listen and they go, okay, I need to pay attention to this. Some doctors are a little set in their ways. If it wasn't in their medical textbooks when they were in school, sometimes they're like, hey, it's probably not worth knowing. I need you to go to some other specialty. So making sure to advocate for yourself, making sure that you explore options. You don't have to stick with one doctor if it's not working out. And then really paying attention to, outside of those post-concussion symptoms that are considered common, other things can happen. So as you know, Bethany, there's some wild symptoms our patients have, which we could dive into if we want. But if you say autonomic nervous system, we'll be here forever.
I don't know. I think we should. I think we should at least like hit on some of them, because there are people out there who are just thinking they're crazy, and I want them to know that they're not crazy. So let's do it. Let's dive in. Tell us some of the things.
So you go to neurologists because they're the brain people, right? Well, they're pretty good with meds. They're good with, assessments. But if you go to a neurologist, I'm like, whoa, 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 whoa. So I hit my head and suddenly my hair is falling out. I hit my head and suddenly I have high blood pressure. I hit my head and now I have gray nodes where my feet go blue when I'm cold. What's going on? Your neurologist is going to go, I have no idea. That's not in brain realm. Actually, it is. So your nervous system is a network. Your brain commands the blood vessels. When you kind of move your toes and that nervous system sends down signals to that periphery so you can move. And we need to respect that when you get an injury. So imagine, for those, because we don't have video, tilt your head back and tilt your head forward as if you've got a whiplash. Now, where your neck is bending, that is right near where your brain stem is and what are called the sympathetic ganglion. So the brain stem controls automatic processes, your breathing, things that keep you alive. It's the reason that you can go to sleep and not suddenly, suffocate in your sleep.
To wake up to breathe.
So the autonomic symptoms you can have can be really confusing for your standard neurologist. Actually, they can be confusing for a lot of doctors. So here's a general guide. If it's related to rest and digest and fight or flight as a general rule, if the symptom you can think can fit under that category, dive in deeper. Okay, suddenly I'm having changes in blood pressure, respiration, if I'm developing food intolerances, if, I'm feeling hot or really cold, if I'm, again, feet are turning blue, that's probably a good sign your autonomic nervous system is dysregulated. But there can be even more pernicious ones. So your autonomic nervous system is also very connected to your hormonal system. And where are some of our main hormone centers? In the brain, the hypothalamus and the pituitary. So not only can a brain cause, changes in your adrenal system, cortisol, that stress hormone, it can also change the command centers that are sending down thyroid stimulating hormone and all of these other hormones to places like, your thyroid, even bodily tissues. A lot of our patients will note, I've gained weight and I don't know why. So also consider your endocrine system and that autonomic nervous system as potential victims of that concussion as well. We are in a really cool time that if you search concussion with your symptoms, something's going to pop up. If it doesn't, I will be shocked. But it's always good to start there. Don't think, oh, I'm crazy, I won't even look at the internet. Just ask the simple question, hey, Google. I really hope people don't have those Google Homes, otherwise it's going to activate when I say that. But hey, after a concussion, can I start experiencing dry eye? Absolutely, you can.
That's so crazy. The autonomic nervous system is so fascinating, and there's so much to it, and crazy that it can affect the hormones and all of the other. It is just so connected to everything in our body. So really, people will say, I had a patient the other day say that they would get really, really dizzy. Oh, I don't remember what it was. I want to say they like almost passed out just being on an elevator or something. They were like, is that related to a concussion? I was like,
Yeah.
yes, like all of it can all be related to concussions.
The one that just blew my mind was the sensitivity to barometric pressure that patients will experience. Our body needs to regulate our blood pressure so that we don't suddenly pass out and faint, but it's could be possible that a concussion could even affect your ability to go up and down in altitude.
So interesting. Is that even from like sitting to standing, or is that more of a vestibular thing?
So that's a tough one. So when you're going from sitting to standing, your vestibular system will activate a little bit, not as much as you were to like bend over, for example. So that's probably a pure autonomic response in that when you're standing up, suddenly the vessels in your lower limbs have to pump harder to get the blood flow back to your heart. So that's more autonomic versus if I was to bend over in my chair, that would be my vestibular system activating and go, hey, autonomic nervous system, don't send so much blood to the brain. A lot of it's flowing there right now. You need to do the opposite, shoot it back down towards my torso. And they work really beautifully in sync. But after concussion, sometimes if you activate the vestibular system the wrong way, it can cause autonomic issues and vice versa.
Oh man, it's so complicated and so crazy. So what can people do? Is there hope for,
Yeah.
for if somebody has PCS?
There are multiple different facilities that respect post-concussion syndrome cognitive effects. The Shepherd Center, there's a couple centers opening up in California that are really starting to kind of aggressively pursue PCS, post-concussion symptom research. So I will say that it's going to be a search. You got to figure out what works for you. Typically what you're looking for is a multimodal team. That's kind of thing number one. You want to see occupational therapists, you want to see cognitive therapists, you want to have multiple assessments, you want to even pursue blood testing, for example, or get a center that's willing to refer you out to do, endocrine exams, for example. Now, if you're on your own and you're like, I'm in the middle of, my final semester at college, I just need a Band-Aid. Generally, medications aren't the way to go. Unfortunately, we have a significant number of patients reporting the medications either did nothing or increased symptoms. Doesn't mean it's going to happen to everybody, but physiologically, this makes sense. Some of these medications are targeting brain centers, but if you've had a concussion, your brain's functioning in a completely different way. You're not that control patient that took the pill and was like, I feel fine. Your brain's already struggling with the brain injury. Now you're giving it another chemical to handle. It just might be a little bit too much at that moment. What you're going to want to focus on is diet, exercises, and what's called destimulation. We, especially in the US, go until we burn out. And then we do it again and again.
Yep.
So making sure to have multiple rest breaks during your day, focusing on diaphragmatic breathing, doing that palming I mentioned before, for example, making sure to get light at the beginning of the day and the end of the day at dusk, so you can kind of regulate your circadian system. All of these little, generally healthy things that you might have put off, like, I'll do that when I'm, have more time. Do them now. Rest, relax, restore, give your body that pump of blood flow when you're exercising, even if it's just a simple walk. Give it good foods. It will help.
That's so good to know. And so interesting that the things that our body and brain needs are the things that we always need, but we actually like legitimately have to make room and time for them to function well when we're really good at that. So interesting. Thank you. Are there more resources or places that you would recommend people look to learn more about that? Like what kinds of foods?
I'll send you a list. There's a ton, but there's a couple main ones that I can't think of right off the top of my head. But CFX, Cognitive FX, has that ANS blog, which is really, really good. But I know that the Shepherd Center, Mayo, CDC have some great infographics. For example, the CDC did one on specifically childhood concussions, how to recognize them. They did the beautiful PDF, which is all these explanations. So I'll get you a list of just a goodie bag of all the things.
Perfect. Oh, that's great. Thank you. And I will include those in the show notes. So look at the show notes if you're listening to this and want to know all of these details and where to look to find more information. That's awesome. Thank you so much. So this is maybe my sweet father-in-law is so supportive and wonderful. And after he listened to one of my interviews with, which was an interview with Paige Moore, it got him thinking about concussions. So I'm going to read you his question. I'm curious to hear your thoughts on it. So he said, I've been thinking about the symptoms of a concussion, and I wonder exactly what is a concussion and how do I tell if I've had one, which is why we're having this conversation, part of why we're having this conversation. He said, I remember getting hit on the head plenty of times. One time as a teenager, I was putting up a barbed wire fence and an 8-foot-long 2-inch pipe slid off the truck and smacked me on the head. I was dazed, confused, and didn't know what happened until I saw the pipe hit the ground. I never thought of it as a brain injury, and I never sought medical attention, and I don't believe I ever had any lasting effects from it. But hearing Paige talk about how symptoms she thought she was past gradually reappeared along with other symptoms after an accident that she didn't believe caused any further brain injuries make me wonder how many people are dealing with latent symptoms that they didn't connect with a past TBI. So what are your thoughts on that? How common is it for people to be dealing with symptoms of a concussion and not realize that that's what's happening? Or, having had a head injury, like as a teenager, could that be affecting or make it more likely for them to get PCS later?
Yes. So he definitely had a concussion. While I can't make a diagnosis, that's like something you'd include in a textbook.
Yeah, right. Classic.
Let's take his situation. So it sounds like he was a pretty healthy young man. I put up barbed wire fences. You sweat a lot. And it sounds like he definitely had symptoms, but he doesn't believe he may have had any lasting effects. So as a male, again, males may get more concussions, but they're less likely to develop post-concussion syndrome after one concussion. Maybe he got away scot-free. Maybe, he could go through the rest of his life, no more concussions, no symptoms. It's really difficult to tell. Sometimes it takes our patients aging and maybe another injury to go, oh, yep, that concussion in my teens was definitely a thing. Kind of a reminder about oh, things did change. Oh, I recognize these symptoms. They're just, 10 times larger and affecting my life more now, but I definitely had some of these before. But it can also, sometimes you can just have symptoms. ANS issues happen to run in my family. Even many of our super healthy, no concussion, especially us gals on my mom's side, we have Raynaud's, for example. Our feet go blue when we're cold. And that's just normal. But you can also have patients that may have more vestibular issues. Maybe something runs in their genes that they're just more likely to get a little bit dizzy on a Ferris wheel, for example. So oftentimes we want to look at, do symptoms increase with heightened cognitive or physical activity? So if your father-in-law, was like, oh, actually, yeah, I get really nasty headaches when I exercise. That's definitely a symptom we see often with post-concussion syndrome. So suddenly he became much less active after that injury. And he's like, oh, wait, the reason was I started having headaches when I would be physically active, couldn't put up barbed wire fences anymore. It's a pretty good sign it may have affected him more than he thought. Mm-hmm. And with the cognitive side of things, in multiple sclerosis, they talk about the spoons, how many spoons you have. It's always a good idea to not just ask yourself, can I do this thing anymore? But how much does it take out of me? So after my injury, or before my injury, I could read a book in one sitting. Then I got my injury. Now I can read 2 chapters, maybe even up to 5, but then I have to take a nap. So you can still read, but it takes a lot more out of you to do that. So looking at your gauge more as not a if or if not, do or do not. It's more of a Yoda, try and see what happens.
Love it. Okay. So yeah, you were referencing to the spoon theory, which is you have a certain number of spoons of energy basically, or what you can accomplish in a day, and an injury can kind of take away some of those spoons and make it so you can't do as much. So that's a really good point. If you can still do the things, but it takes a lot more out of you, then that might be an indication. Because fatigue is a very strong symptom that a lot of people have.
Both cognitive and physical. Just generally your batteries don't hold as much charge.
Yes. Okay. Well, thank you. That's a really helpful response to that. So in your experience with seeing so many patients and their families dealing with post-concussion syndrome, what common struggles do you see, or any advice that you give to caregivers, family, friends of those dealing with PCS?
Yeah, this is where we need to talk about invisible injuries. So brain injuries are often called invisible injuries because it's not like you shattered your leg and you were in a cast in a wheelchair for months upon months. It's hidden. And again, back to that compensatory, we can adapt, we can push through. I do think this is why PCS is really traumatic for family units, for friends, and for the patient themselves. Because as you mentioned it, there's the, am I crazy? You know, am I suddenly having arguments with my wife almost every day because our marriage is on the rocks? Or is it because I'm having mood changes and I get irritable really quickly? Am I a bad mom because I don't have the energy to play with my toddler anymore? Or was that hit to the head, did that cause my battery to really just my stamina to decrease? So don't measure brain injury symptoms the same way you would a physical injury or cancer or multiple sclerosis, because we're humans and we sometimes want to go, but you look fine. It's so easy to just be like, everything's normal, we're all okay. It's okay to go, there's an issue, let's figure out what's causing it. And respecting that, yeah, it can be scary sometimes to think, oh my gosh, my brain was injured. I only got one, you know? It's okay to just sit in that discomfort for a moment and go, okay, maybe I had a brain injury, but you know what? Those are fixable. So yeah, I would say that we definitely see a lot of divorces. We see a lot of marital issues. We see a lot of parents feeling like they're not able to take care of their children. It's difficult, but that's where I do think getting immediate help, kind of preventing the long-term, I call it scarring, that can sometimes happen, is really, really helpful. And then it's also on the family members to do their own research, watching videos about people with symptoms. Sometimes you can be like, okay, I've heard of, my wife talk about symptoms for months and months. I need to hear somebody else say it, just to kind of confirm it's real. Search Google. There are so many people that are sharing their stories, and it can make you feel like, okay, I actually might have learned some things that I can talk to my partner about or my friend about. And then it really creates PCS as this real thing that's tackleable. It's something that we can work with if we see it.
Yes. Okay. I love that. Thank you. And I think we had a conversation with some patients and their family members the other day, and they asked, what can we do to support my husband, my dad, who's dealing with this? And somebody said, just believe them when they say what they're dealing with, because and I've heard lots of other people say that was one of the hardest things that they dealt with was like not only thinking themselves, like questioning themselves, am I crazy? But also the people around them not believing. And it's understandable that people don't understand it, but I think that's something that a family member or loved one can do, is just to say, I don't understand it, but I believe you. And I'm here for you, and I love you, and I'm sorry you're dealing with this. And let's see what we can do to help.
And there's this huge shift in communication. So there was a patient and her significant other that I worked with, sat down, talked with them for long periods. And she had this revelation where her significant other would go, are you okay? Are your symptoms bad? And she was like, I am so overwhelmed. My cognitive flexibility is down to a minimum. I can barely focus on walking right now. Don't ask me that open-ended question. So they changed the narrative where he would go, what number are you? And if she was a 1, he was bad. He was like, I'll take care of dinner, I'll take care of the dishes and the kids, you go lay down. Or she could say, I'm at a 10. And he could go, cool, do you want to go take a walk with me? We could chat, we could throw a tennis ball around and do your post-epic exercises. So also for understanding that you may need to find little tips and tricks to work with somebody that's had a brain injury, and that will significantly help your relationship.
That's beautiful. I love that concrete example. Thank you. And I'm just going to throw out there, in case people don't know what post-epic exercises is, the EPIC treatment is what the treatment is called at Cognitive FX. And then yes, after we have post-EPIC exercises, things for people to continue to deal with. So.
Brain injury rehab exercises your OT may give you, like the Bruck string or attention exercises. A lot of patients going through PCS will get very familiar with the Bruck string is a white string. Well, Bethany could probably explain it better than I can, but a white string with different colored beads, and it's actually used to work on convergence, divergence, and other visual stuff. So there's a lot of tools out there for PCS symptoms, pretty crazy ones too.
Yeah, yes. And there is so much out there. That's I want to let people know, yes, this is a real thing. And there's real things that you can do to actually recover and heal from it. The brain is plastic. Neuroplasticity is a thing, and it's the coolest thing. There can be improvement. Okay. And so I just want to throw this out there here near the end, and we don't have to go too into detail about it, but I'm curious, about CTE, the chronic traumatic encephalopathy. What should people know about that? Or is that a huge risk for a lot of people? It seems like it would be more on the high impact professional sports kind of realm, but what would you say about that?
We have a lot of patients that are concerned about CTE because they've had a history of concussions and it's been talked about in the media. Typically, the thought and the science realm is looking more into it's these repeat subconcussive or kind of almost undiagnosed concussions, where these like NFL players, for example, will hit another player really hard, but maybe their balance is fine, they seemed okay, but hundreds of these over their career may in fact cause CTE, versus if you've had one or two, or goodness, even up to 8, you're not going to be, at risk as much as someone that's had those hundreds. CTE is unfortunate because we can't diagnose it before the person has passed away. So it requires actually looking at brain tissue, so postmortem brain tissue, to be able to diagnose it. There is some research looking at advanced neuroimaging. So having somebody with something on their head or in an imager and you're doing tasks to see the brain light up and to go, oh, okay, that area might actually be injured, but it's in its infancy. We've got a long way to go before we can, for example, detect biomarkers of CTE. So biomarkers being markers in your bloodstream or in your brain that let a physician know, okay, you've either had a concussion or you're more predisposed to CTE after that concussion. The research is coming along, but generally, if you've had a couple concussions in your life, don't get too worried about it. And if you've played a lot of football and you don't have a neurologist, sit down and talk to them about this. If it's a real concern that you have, it's always good to have a conversation, because there may be lifestyle changes that we know can help with preventing the onset of dementia or delaying it, that could potentially also work for CTE. So think of CTE as a neurodegenerative disorder. So a lot of methods that may work for disorders we've been researching forever may also be effective for it. Again, not a lot of science behind it yet, but what's going to harm you about getting 8 hours of sleep a night and drinking a lot of water? Nothing.
Right? That's awesome. Well, and it sounds like there's a lot of research there's a lot of things we don't know still. A lot to learn, a lot to be educating ourselves on. But yeah, interesting that those back to basic things can be really helpful for everybody. That's helpful. Thank you for that. Another random question here. Is there much of a difference or something that people should be aware of in the way concussions may present within childhood babies versus teenagers versus adults?
Yeah. This actually goes back to kind of symptom reporting. Babies aren't going to be able to report symptoms, but if they are more fussy, if they scream more often, if they seem to be in pain, if suddenly they're having tummy troubles, always good to get that checked out. In our kind of kindergartners, maybe elementary school, they're able to report a little bit better. Again, that's where they might go, my head hurts. Their teachers may be going, Tommy cannot focus. So, he was my star student and now his brain wanders off, at any second of the day. You could start noticing tantrums, for example. The tricky age is teens and puberty, because there's already so much going on. It can be really difficult to know, what is this? Is this raging hormones or, them in soccer and taking a tumble? I don't have kids myself. I can't speak to it. I'm going to defer that to the MDs. They can deal with it.
Okay.
Generally, once you're in kind of college years up to adulthood, that's where it's a little bit easier to do a complete assessment. You can do neuropsych tests, you can do balance tests, you can have a patient meet multiple times with the doctor and talk about their symptoms in a little bit more detail. But yeah, I would say that definitely those early childhood years are the most difficult. So again, a good place to really focus on getting a clinical assessment by a professional. Not that everybody shouldn't get it, but specifically for kids.
Okay. Kids and teens, it sounds like too, right?
Yeah.
Okay. All right. That's helpful. Thank you. All right. Anything else that you want people to know about concussions and their effects and just things to be aware of?
Oh, let me think for a second. I don't know. We've covered a lot.
This has been a good, thorough conversation. I really appreciate it.
Yeah, of course. Oh, maybe one last thing, which is we talked about kind of family members and friends. Let's talk very briefly about talking with your doctors, talking with your employers, and talking with your schools.
Yes, thank you. Great points. Yes, please do.
Most of the time, it's going to be a difficult conversation. Again, A broken leg works like, yeah, stay home, you're good. A brain injury can be a lot more difficult to talk about. Sometimes you can find advocates. Maybe you have a partner, or even your psychologist can write a letter, for example. Maybe if you're overwhelmed and you just need somebody to say the words for you, don't be shy. You really need to focus on yourself and your health. You may need to push, you may need to send them research, and you may need to break up with some people. So again, changing doctors is not a bad thing. For schools, for example, there are accommodations for kids. So here in Utah, we actually have a really good system right now where anyone that sees an injury has to report it. We have to watch the kid. We have to send a letter home with a parent. So, catching that concussion, being able to track it is a great thing. And most schools will have plans. Okay, you're recovering from a concussion. We're going to give you extra breaks, give the kid extra breaks. We're going to make sure that if they need to go home early, if they've got a really bad headache, they can do that. And most colleges do as well. So look into what access to accommodations you can get. And sometimes if there are places that are really pushing against you, having accommodations, it's also okay to sometimes take a little bit of a break, to take a semester off. I've had multiple patients where if they take a semester off, their GPA stays good, they recover better, they're able to jump back into school much, much more. So yeah, it might be a battle for you. I really hope that most of the people that go to, the people in charge and immediately are like, no, you've got a brain injury, we can handle this, but don't back down from a fight either. Figure out who can help you, figure out legally what's appropriate. Your work may be legally responsible to give you time and relaxed hours to recover from that injury, and stick with it.
Yes. Is there a certain amount of time, and I guess it depends on the person and the injury, but amount of time that they are recommended to, or that they should be requesting for those accommodations or time off or decreased hours or whatever?
There's no golden rule. Typically, a lot of it's based off of symptoms, with respecting also that, again, if you're still working from home half days, you might be using your computer. That might increase symptoms, for example. So it's hard to know. The general thing that I've seen in our patients is that try to go down on as many hours as you can, especially during that early phase, so that you can incorporate a lot of the things we just talked about in your day-to-day life and you're not solely focused on work or school. And if you're going to go back, build up slowly. Don't immediately jump back into a 60-hour work week. It's like trying to quit smoking, cold turkey. It's just not going to work. So slowly increasing, making sure that you are checking in with your medical practitioner so they have a record of your symptoms and they can work with your school or work, etc. But I've had some patients where they've been back within a month and some patients where they needed up to 6 months. Again, if we're developing post-concussion syndrome, you may need more of a drastic intervention. Recovery may take a lot longer. So it depends on the person.
Okay, that's helpful. Thank you. And I know that this is a concern. I'd just be interested in hearing your thoughts on what you would recommend people do for, adults who are in a job that requires a lot of cognitive functioning, executive functioning, really high, intense work. I know a lot of people are nervous about having that conversation with their employer because their employer may question whether they're capable of doing that job at all anymore. And, there's a risk there. What advice do you have for people in that situation?
Yeah. Having a game plan before you step into that office. Go. I've researched this. I've talked to my doctor. Here's what we're doing. Here is my prior work performance. And here's what I've shown you that I can do so far. So if you come to them with, very responsible of just like, I may need a couple months where I don't perform as well. I don't put out as many articles or check as many Excel sheets, but I want to get back to that level. So employers are generally really receptive to this because it's kind of like, okay, it informs them about, it takes a little bit to recover from a brain injury. They also go, okay, this person is on top of it. They're seeing their doctor. They want to get better. Now, ultimately, sometimes if you're having symptoms for a long period, some employers may decide not to keep working with you. It's an unfortunate fact. In some cases, you just have to take it as, all right, next phase of my life, I'm going to do something new. So that could be a little bit difficult, but I really think that getting everything tidy and set in a plan at the beginning is just going to make everything else, even sometimes leaving the job, a little bit easier.
Yeah, that's a good point. And I like the point you made at the end too, with if it's, even if things do change, that can be ultimately for the good. So remembering that, I think, is important.
We had a patient that I was in contact with for a long time. So he was doing research on like geothermal vents. So PhD student. And then he emailed me after, and he actually changed degrees, and he was going into neuroimaging and brain injury, and he loves it.
Oh,
so
that's awesome. Yes. It's been really interesting as I've been doing these interviews and talking to people. Almost everybody says, this was the hardest thing. I would never wish it on anybody, but I wouldn't trade what I've learned for like anything. So it's pretty amazing to see the good that can come out of something so hard. So anyway, awesome. Well, I so appreciate you sharing your knowledge and your expertise and all of the different aspects of this injury, because there is so much to it that, again, people don't know about at all, or they don't fully understand it. So, and it sounds like we're still learning. There's still a lot to learn about it, but thank you so much for all of this. And I think it's going to be really helpful for a lot of people.
Okay. Thanks again for having me. This was really fun.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.